Which of the following is the primary role of the oxygenator during CPB setup? A. To regulate blood pressure. B. To deliver oxygen to the blood and remove carbon dioxide. C. To monitor the patient's temperature. D. To pump blood through the circuit. Answer: B. To deliver oxygen to the blood and remove carbon dioxide. Explanation: the oxygenator serves the key role of oxygenating the blood and removing carbon dioxide while the heart is stopped during surgery. It mimics the functions of the lungs in maintaining gas exchange. What should be done to ensure the safety of the CPB circuit when the machine is switched on? A. Adjust the pump speed immediately. B. Confirm the oxygenator and heat exchanger are functioning properly. C. Start the bypass and monitor for any abnormalities. D. Open all clamps to ensure unrestricted flow. Answer: B. Confirm the oxygenator and heat exchanger are functioning properly. Explanation: before starting CPB, it is critical to confirm that the oxygenator and heat exchanger are functioning correctly. This ensures the patient will receive adequate oxygenation and temperature control throughout the bypass procedure. Which of the following should be checked in the CPB circuit to prevent inadequate venous return? A. Verify that the arterial line filter is clear of clots. B. Ensure that the venous reservoir is filled to the appropriate level. C. Confirm the oxygenator is primed with saline. D. Adjust the pressure of the venous cannula. Answer: B. Ensure that the venous reservoir is filled to the appropriate level. Explanation: ensuring that the venous reservoir is filled to the correct level helps to maintain optimal venous return during bypass. If the reservoir is too low, the system may experience negative pressure, leading to collapse of venous lines and inadequate blood return. What is the best practice to follow when priming the CPB circuit? A. Use a heparinized saline solution to prime the circuit. B. Prime the circuit with fresh blood from the patient. C. Ensure the oxygenator is not exposed to saline during priming. D. Prime the circuit using a mixture of saline and oxygen. Answer: A. Use a heparinized saline solution to prime the circuit. Explanation: priming the CPB circuit with heparinized saline ensures that the circuit is free of air and reduces the risk of clot formation. Heparin is used to prevent coagulation during the procedure. Which of the following is a critical safety check before bypass is initiated in a CPB setup? A. Check that the heat exchanger is properly calibrated to the patient's body temperature. B. Adjust the speed of the CPB pump to the target flow rate. C. Ensure that the arterial filter is in place and functional. D. Ensure that all suction devices are turned off. Answer: C. Ensure that the arterial filter is in place and functional. Explanation: the arterial filter plays a critical role in preventing the return of debris or air emboli to the patient. Before initiating bypass, it is essential to verify that the filter is in place, functional, and free from any blockages. What is the appropriate response if there is a significant leak detected in the CPB circuit during setup? A. Increase the flow rate to compensate for the lost blood. B. Continue the procedure and monitor the pressure levels. C. Immediately locate the source of the leak and fix it before proceeding. D. Prime the circuit with more saline to flush out the leak. Answer: C. Immediately locate the source of the leak and fix it before proceeding. Explanation: if a leak is detected in the CPB circuit, it is essential to immediately stop and locate the source of the leak. Continuing bypass with a leaking circuit could lead to further complications, including air embolism or inadequate perfusion. Which of the following should be checked to ensure proper functioning of the CPB pump during setup? A. Verify that the oxygenator is receiving a steady flow of oxygen. B. Ensure that the venous lines are free from kinks. C. Confirm that the pump is generating the correct flow rate. D. Test the temperature of the oxygenator. Answer: C. Confirm that the pump is generating the correct flow rate. Explanation: ensuring that the CPB pump is generating the correct flow rate is vital for maintaining adequate perfusion during bypass. If the pump flow rate is too high or too low, it could lead to inadequate blood supply to the organs or cause damage to the circuit. Which of the following is the most important check when assessing the integrity of the CPB circuit? A. Verify that the temperature of the oxygenator matches the patient's body temperature. B. Check for any kinks, leaks, or disconnections in the tubing. C. Confirm that the pump speed is set to the target rate. D. Ensure the oxygen saturation is maintained at optimal levels. Answer: B. Check for any kinks, leaks, or disconnections in the tubing. Explanation: checking for kinks, leaks, or disconnections in the tubing is crucial for ensuring the integrity of the CPB circuit. Any issues with the tubing can lead to pressure drops, air embolism, or loss of blood volume, which can jeopardize the patient's safety. Before connecting the CPB circuit to the patient, which of the following must be done? A. Ensure the CPB pump is running at a lower speed to prevent pump damage. B. Make sure the circuit is primed with blood and free of air. C. Check that the patient's oxygen saturation is within normal range. D. Administer a dose of heparin to increase anticoagulation. Answer: B. Make sure the circuit is primed with blood and free of air. Explanation: before connecting the CPB circuit to the patient, it is essential to ensure that the circuit is primed with blood to prevent air from entering the patient's system, which could cause air embolism. The circuit must also be free of air to ensure smooth flow and oxygenation. What is the purpose of the arterial filter in the CPB circuit? A. To oxygenate the blood and remove carbon dioxide. B. To warm the blood before it is delivered to the patient. C. To filter out microemboli and air bubbles from the blood. D. To monitor blood pressure and flow rates during bypass. Answer: C. To filter out microemboli and air bubbles from the blood. Explanation: the arterial filter is a key component of the CPB circuit. It filters out microemboli, debris, and air bubbles from the blood before it is returned to the patient, preventing these particles from causing embolic events or organ damage.